Depression, a word that we're all familiar with, an issue that is as local as it is global. Kerala, a small state in the southern part of India, is home to the highest prevailing rates of depression in the nation. Major depressive disorder, or clinical depression, is a complex and heterogeneous syndrome that affects a whopping 208 million people worldwide. The now commercially available diagnostic methods for depression are either self report questionnaires or clinical interviews, which can be subjective and prone to variability. We first envisioned an objective tool to aid the diagnostic process for MDD, only to find that there is a severe lack of research and data on the biological basis of mental illnesses.
And that's where we come in. We introduce OASYS, a blood biomarker-based tool complete with a microfluidic chip and a hardware system that can aid in the diagnosis of MDD. After extensive literature review, we chose 5 putative biomarkers which show a correlation to MDD, namely serotonin, cortisol, GS-alpha protein and microRNAs 124 and 132. Further, we constructed Bayesian network models to analyze and choose the right biomarkers for our project. Both our quantifiers, magnetic nanoprobes and FRET aptasensors work on the principles of fluorescence resonance energy transfer, or FRET in short. This concept was introduced to us by Dr. Prashant Kodgire from IIT Indore. FRET aptasensors are made of aptamers tagged with a fluorophore and a small complementary DNA strand tagged with a quencher. Initially, the aptasensor produces no fluorescence, while in the presence of the target, the cDNA strand gets displaced due to lower affinity, and the newly formed aptamer-target complex produces quantifiable fluorescence. Nanoprobes are DNA-stranded molecular beacons attached with a FRET pair that show fluorescence only upon binding to the target microRNAs. Multiple of these double-lobed beacons are attached to a magnetic nanoparticle in order to concentrate the amount of fluorescence produced onto a smaller area and detect lower concentration of microRNAs.
To obtain our ideal quantifier, we oriented ourselves to multiple DBTL cycles. For forming the best possible cortisol aptasensor, we identified a truncated cortisol aptamer for which we designed the cDNA to form the aptasensor. Using the data we obtained for the fluorolog machine, we determined the best molar ratio of aptasensor to be 1:2, corresponding to only 10% quenching in the duration of 90 minutes. The 1:2 molar ratio of the aptasensor was then used to test the sensitivity of the quantifier. The results show less sensitivity within the human physiological range of the cortisol in serum, with no significant increase over an incubation time of 60 minutes. We can conclude that the truncated aptasensor is an ideal quantifier for cortisol. We then identified another cortisol aptamer which is 85 base pairs long. We designed 2 different cDNAs for the 85mer. cDNA1 was designed based on suggestions by Dr. Tarun Kumar Sharma, while cDNA2 was designed based on the KD value of the aptamer. The fluorescence-based test gives us an observable quenching of 30% on the formation of the 85mer aptasensor, which is an improvement from the previously seen 10% quenching from the observed truncated aptasensor. We performed an ITC to determine the binding efficiency between the cDNA1 and the 85mer aptamer and compared it with results from an ITC between cortisol and aptamer alone, which showed that the cortisol and the aptamer attain saturation quicker than the cDNA and the aptamer complex, meaning that the cortisol can displace our cDNA strand. Sensitivity tests were also performed to show an increase in fluorescence intensity upon binding with our cortisol molecule, and there is a greater fold change observed in the comparison to the truncated aptasensor. From these rounds of DBTL cycles, we have determined that the ideal cortisol aptasensor can be formed using a combination of the 85mer aptamer and either cDNA1 or 2. For determining the ideal serotonin aptasensor, a similar DBTL cycle was followed. We designed 2 different cDNAs for a chosen 45mer serotonin aptamer, similar to that of the cortisol aptasensor. We tested the formation of the serotonin aptasensor for cDNA1, and the maximum signal was obtained for the molar ratio of 1:3, corresponding to 30% quenching. The experiment was again repeated using cDNA2, and there was an increase in fluorescence observed upon hybridization of the aptamer and cDNA, hence suggesting that cDNA1 is a better choice for the formation of our serotonin aptasensor. This conclusion is aided by the ITC results we obtained showing a sigmoid curve depicting a relation between cDNA1 and the serotonin aptasensor. We used cDNA1 with the serotonin aptamer to perform a sensitivity test. We noticed a linear increase in fluorescence with increasing concentration of our serotonin biomarker and an observable increase over an incubation time of 60 minutes. To test the specificity of our serotonin aptasensor, we tested it with multiple biomarkers. As expected, there was a greater increase in fluorescence when serotonin was added. Moving on to our magnetic nanoprobes, we initially started off with the characterization of nanoparticles, where data from the Zeta analyzer from the ion nanoparticles shows a peak at minus 21 millivolt, suggesting the presence of carboxyl group. To determine the size of the procured nanoparticle, we also performed a TIM analysis. To confirm our probe formation and its binding to its respective miDNAs, we performed a native page analysis, observing a conformational changes upon formation. As we see from this gel, sequences A plus B plus C, which is present in lane 6, has just one band, which is higher than the A plus B band found in lane 5, indicating that these three sequences are bound together by complementarity and form a stable structure. Now we can also see that the band in lane 7, which is probe plus miDNA, is slightly higher than just the probe, indicating the miDNA binds to the probe. Performing fluorescence intensity experiments, results indicated a clear increase in fluorescence upon addition to the magnetic nanoparticles to the probe. We conducted a sensitivity experiment to check the limit of detection of our nanoprobe. For 10 picomolar concentration of the miDNA, which is the least of our selected biomarkers, we observed a 16.4% and 17.2% increase in fluorescence intensity, respectively for miDNA 132 and 124.
To integrate OASYS into real-world clinical settings, we scaled down our assays onto a portable and user-friendly microfluidic chip. The chip takes in blood sample as an input and lets it flow through 5 channels equally, each containing a biomarker-specific quantifier. Each channel includes a mixer where the biomarker and quantifier bind together, which we have confirmed using simulations on COMSOL. So on the inputs of Dr. Lights and NG, we redesigned the chip with equal angles between the channels to obtain an equal distribution of blood. We calculated the corresponding flow velocities and Reynolds number to prevent any turbulent flow. We also worked on a model to predict the amount of blood our tool would require for an effective diagnosis. After running our assays, the quantifier biomarker mixture will be stored at the well at the end of each channel where the fluorescence gets detected.
To quantify the biomarkers through this fluorescence, we built an efficient, affordable, and highly sensitive hardware device. Reducing the cost and complexity of the device, and after multiple testing and learning cycles, we chose the most sensitive sensor, a photodialytic. We performed 3 categories of experiments. First, a controllable electronic test, where we use a green LED to mimic fluorescence and try to determine the limit of detection for the sensor. Second, stable chemical samples were used to determine the sensor's lower limit of detection, which outperformed the LED due to the photodiode's voltage-dependent behavior. We used serial dilutions of PTE DCM to refine the limit of detection for real lab samples. Finally, a test on a complex biological system, using our own nanoprobe and FRUT aptamer samples with their respective biomarkers. We were able to detect nanogram per ml scale concentration changes and achieved similar trends to those obtained with the laboratory fluorolog machine. We've constructed a prototype which has a 3D printed outer shell consisting of an Arduino Uno board, a breadboard connecting the sensors, and a 480 nanometer LED to excite the fluorophore.
Coming to the real world and looking into prospective implementations, OASYS can be used to generate biomarker data to understand their correlation with MDD, thus aiding in setting the threshold levels of these blood biomarkers. Coming a full circle, this allows the tool to be functional as a diagnostic aid. The prognostic capacities, ability to track the effectiveness of antidepressants, and flexible design of OASYS make it an efficient tool that spans multiple end users. We want to develop a secure cloud database for biomarker data collected from patients by respecting user privacy and ensuring consent. Our chip can be further optimized to incorporate new blood biomarkers, showing more promise for MDD. The model can also be extended to other diseases with established blood biomarkers. Following our proof of concept experiments and prototype testing, we conducted a SWOT and TRL analysis of our tool, which assisted us in planning our future steps. After expressing an interest in our project at the All India iGEM meet, companies like Anvaya Biotech approached us for collaborative opportunities. We also plan to pitch our idea to more venture capitalists and incubation centers to take our project forward into the future.
Throughout our iGEM journey, we interacted with people across diverse backgrounds, fields of expertise, and ideas. Starting right from the identification and understanding of the problem through phases like finding a solution and implementation of OASYS, all our interactions were guided by the IDERAC cycle. Short for Identify, Engage, Reflect, and Act, the cycle ensured that all given inputs were thoughtfully considered and integrated into the project. We also conducted a power analysis of our 6 stakeholders to ensure that we explored every influence of the real world on and by our project. To better understand and demonstrate the problem of misdiagnosis caused by the variability and subjectivity in MDD diagnosis, we designed small-scale social experiments involving a group of psychiatrists and test subjects. This was done with the help of a psychologist and a sociologist. An important change we made by integrating human practices into the project is in the way we pitched it. Following multiple meetings across stakeholder groups, we realized that the focus of the project needed to shift from biomarkers, since it gave out the wrong impression that their correlation to MDD is established. Simultaneously, we also recognized the importance of building biomarker data for research, especially in the field of psychiatry. Thus, shifting the focus of the project to the technology, our tagline evolved from a blood biomarker-based diagnostic kit for MDD to a novel, FET-based microfluidic device to diagnose major depressive disorder. The impact of scientific research goes far beyond the confines of a laboratory, profoundly affecting people's lives all over the world. To ensure responsibility in our work, we interacted with people from diverse backgrounds, like the women representative from Anganwadis and transgender individuals from Sangat, an NGO that promotes mental health equity. We also interacted with one of our most important stakeholders, the patients of MDD, through an anonymous pan-India survey.
Our project was defined by the people we interacted with throughout our journey. We discovered immense joy and purpose in listening, learning, growing, and imparting our knowledge to others through iGEM. We seized every opportunity to talk to people about our project, even in the remotest villages in the Himalayas, in the Spiti Valley, 3,200 kilometers away from home.
Inspired by the entrancing Spiti journey, we stepped into our very own neighborhood villages to listen to people's stories and understand their lives. We talked to Anganwadi workers, the caregivers in primary healthcare centers, and to tribal promoters in our efforts to reach out to the local communities and to the many tribal settlements in our area. We learned of the grave situation of mental health morbidity in the rural villages of South Kerala, especially among the female population. We decided to visit the primary healthcare center and learn about the local mental health care programs implemented by the government. Equipped with this knowledge, we sat in on a meeting with the local Kudumbashri workers attended by over 50 women. We shared information about existing mental health care facilities and distributed our informative pamphlets. We collected people's opinions and inputs through a mental health awareness survey which received over 470 responses. We also interacted with patients diagnosed with MDD through a panel discussion and personal interviews called Into Their Stories. We went on to organize an awareness camp in the IT hub through a flash mob, interact with kids in an orphanage in Chennai, conduct a street play in a market, hold a talk on mental health importance in our college, and reach out to the elderly at an old age home in Haridwar with the help of our friends at IIT Roorkee. Through these events, we realized that bringing an objective perspective to the MDD diagnosis process alone will not improve the mental health situation. To tackle the rampant ignorance and stigma, mental health awareness is just as important. iGEM not only gave us the opportunity to interact with the local public, but also a means to spread the science we learned to the general public. Taking inspiration from the volunteering at the VVM camp, we visited 2 different high schools introducing unconventional methods of teaching, events that we named iGEM Pathshala. We also helped hold a 3-day camp on our campus for over 70 high school students, receiving heartwarming feedback through worksheets and comment boards. We prepared a DIY SynBio kit and a set of myth-busting cards as fun and interactive resources. Aiming our science communication to college students, we held a SynBio quiz, a queer science quiz, a SynBio conclave with 4 international speakers, and 2 science talks with Dr. Lekha and Dr. Bittu. We conducted a blurb competition and held an educational event through a dart game. Celebrating the grand festival of Kerala called Onam, we organized a SynBio-based competition called SynBiokalam. Our science communication initiatives transcended barriers of age and region as we interacted with various groups. We have carefully documented all our resources for science education and for mental health awareness. Our database on equipment availability in colleges, science-based games, and a SynBio book aimed at kids, among many others, were curated with the intention of giving back to the community. Despite the immense efforts that went into these events and resources, technical errors held us back from uploading them on our wiki. However, the resources will be made available for everyone to use on our wiki and our social media platforms post the Grand Jamboree. The community kept pace with us through each step along the way. The overwhelmingly positive feedback, the satisfaction after each event, and most of all, the shared joy of learning something new and participating in open conversations about mental health fueled us throughout our iGEM journey.
As we conclude this year of relentless efforts, we look back on the strides we've made and the lives we've touched. This journey of developing our project has been a testament to the unwavering dedication and hard work of our team. As we look ahead, we see a bright and promising future for OASYS. However, our journey doesn't end here. It's just the beginning of a change in the mental health diagnostics landscape. Thank you for joining us on this incredible endeavor.